Well, ag officials are preparing to start testing for bird flu in raw milk on Minnesota dairy farms.
Part of a national strategy to try and keep an eye on the nation's milk supply as the illness spreads among livestock and birds. Callan Gray is here now with how they plan to do that.
The Minnesota Department of Agriculture says it hopes to roll out testing in February. The agency is still working to finalize funding agreements with the federal government. This as another strain has emerged within a duck farm on the West Coast. As a new rare strain of bird flu is identified in California, the University of Minnesota's Veterinary Diagnostic Laboratory is on alert.
If there's a case in Minnesota, how soon would we know?
We try our best to get the results at least by next business day.
They've been testing for the more common, highly pathogenic H5N1 bird flu strain since 2022 as it spread among poultry and then to cattle.
We are the eyes for detecting any sort of high path incidences in the state. So we've been pretty busy with it.
Director Hemant Naikari says they're now preparing for new surveillance of the milk supply as part of the USDA's National Milk Testing Strategy. It's an effort to eliminate the virus from dairy herds.
We actually are working round the clock, so there is a lot of communication that has to happen. Testing is one component of the big puzzle that we are trying to solve.
He explains there are at least 1,600 dairy farms in the state that will require testing starting in mid-February.
The goal is that about 75% of these dairy farms will be tested at least once a month. We are anticipating, close to a couple of thousand tests per month. This is going to be for a year at least.
The outbreak is being closely tracked by health agencies as well, including the American Medical Association, which addressed it in an update this week.
The worry here is that if bird flu circulates long enough, it could also eventually find that right combination of genetic mutations to make it easily transmissible among people.
There have been 67 cases reported in humans so far, including one death according to the CDC, which found a mutation in the case of the man who died.
Right now, the CDC still says the risk to the general public is low, but we also know how easily and quickly that could change. And given this, we really just cannot underestimate it.
There have been no cases among Minnesotans. The CDC recommends those who work with potentially infected animals should wear an N95, eye protection, and gloves. And people should cook poultry, beef, and eggs thoroughly and choose pasteurized milk. Kevin?
Okay, that's